And that number you can call for free consultations as well. It is 12:02 Saturday afternoon. At one time, there was, we should talk about vitamin D deprivation.
Sure.
God.
Yeah, we could talk about that for sure.
We used to have a sun.
We did.
In our solar system. I don't know where the hell it went. But,
yeah.
It's time for you to call in. You have some questions about pain management, anything physical like that. 416-870-6400, star 640 on cell. Dr. Lou here till 1 o'clock this afternoon. We'll get into a bunch of stuff, and we always start the show with kind of a week that was, a look back of some cases that came through the clinic.
Yeah, one of the things, not a particular case that I wanted to touch on this week, but one I started thinking, what are some very common questions that people ask me that I can kind of address here? And I'd say probably the most common question questions that I get from people is, what's wrong with me?
Yep.
What's their diagnosis? Yeah. And then once you can provide that, how do I get it better and how long does it take?
Right.
And obviously, what's wrong with me goes back to the process of what we have to do. Mm-hmm. First and foremost, we have to assess somebody. We have to determine what's going on to come to a diagnosis. Because as I've always said, once you have that diagnosis, you can make appropriate treatment recommendations. Because the evidence, the way we work is we work on evidence-based medicine, which means that once we understand what's going on, we imply the evidence-based approach, which is essentially what's the best available medical literature on whatever's going on to get the person better. What's the clinician's experience, because that matters. And also, what does the patient want? Because sometimes you may have something where, for example, in this type of neck pain, acupuncture is going to be the best recommendation, but the patient may not like needles.
Yeah.
So you have to try to accommodate that.
For sure.
So that's a big one. And obviously, it's a very hard question to answer. And I picked these three questions because people think that there's a general answer, whereas what I want them to understand is all these answers are very specific. So what's wrong with me is specific to you. We have to go through a proper assessment to figure it out. What can you do? There's often, anytime we make a treatment recommendation, we don't just say, here's the one thing that you can do. Yep. We will give you the things, a whole bunch of different things. What's most likely to help, what's next most likely to help, and so on and so forth. And then a lot of the times it's a combination of, here are a bunch of things that you can do. And then how long does it take? Again, is a very, very specific answer because it depends on prognosis. And prognosis from person to person differs. And a lot of people understand what diagnosis is, that they understand that they're being told something is wrong with them. Prognosis is how likely are you to get better? And so many things play into that. So if we took the ideal patient, young, healthy, 25 to 30-year-old, no comorbidities, very simple issue, then prognosis is good. But as soon as you start getting a little bit older or too young, your prognosis is diminished. If the situation that you have is a more chronic situation, a lot of people come in with a problem of 5, 6, 10 years going on, and they think that 2, 3 types of treatments or things like that can get them better. That's not going to happen. It's got to be realistic. So the more acute a scenario is when you present to somebody, the more likely you are to get better from it, that there's no complication. So when we look at, say, something like back pain, if you had back pain that was just localized to the back, your prognosis is better than if someone has low back pain and they also have leg pain, because now it indicates potentially nerve involvement or a referral pattern. Right. And so those things matter to how many treatments, how long it takes for someone to get better, how likely they are to get better. But what I really wanted to highlight was that this is the reason why I'm here. This is the reason why I'm available through 1-855-55-Dr. Lou all the time, is give me a call. We can have that more specific discussion. I get emails. Can you talk about on the air how long it's going to take you to get better if you have pain? Mm-hmm. It's so hard. It depends on where the pain is coming from. So if anyone out there is wondering what's going on with them, they just want a consultation, a second opinion, give me a call. Let's get in touch. I'll do my best to get back to you within 48 hours. We can have a discussion, and if it's something that me and my team can help you with, great. If not, then we'll send you to the right people. I have a health network all across the Golden Horseshoe of different types of healthcare professionals dedicated to pain management.
And if you want to discuss here over the next little less than an hour, you can come on the air and do so, like Jamie here in North York. Hi, Jamie. Good afternoon.
Hi, good afternoon. Thank you for taking my call.
No problem.
For the last year, I've been suffering from mechanical pain, and I've had actually down my leg and, on my left knee, I've been having a lot of pain where I've been not been able to go to work because I've been having a lot of hard time standing in my work, because I work in a car detailing shop where you're always on your feet and you're using your muscles, and you're constantly, like bending. And I think this issue with my work has, for some reason, it's been affecting me where it has been taking a toll on my life.
Okay. Yeah.
And I went to the doctor, 3-4 times. I was on a medication called
Diclofenac.
Diclofenac to help. It did, but then when I go back to work, like say I was off for 2 weeks, and then I go back to do my occupation, after a week of me working, say, 40 hours a week, I find that the standing in my, constant standing and bending has really jeopardized my overall health, and I've been having a lot of times where it's just been going on, and I've been feeling very upset that I'm not getting the proper medication. And do you guys know as to what treatments can I do? So, because mechanical pain, I think it's just wear on the muscles.
Mm-hmm. So Jamie, a couple of things here.
Sure.
First, it kind of goes back to what I started with as we were talking. It's obviously every case is very different. Whatever the mechanical pain is very different.
Right.
One of the things to understand about medication, which has a role in pain management, 100%, it helps to mask a symptom so that you can do things actively to get better. So any type of mechanical pain or physical pain, I always say, needs a physical intervention. So oftentimes patients will present somewhere, they're given a medication, they're also probably recommended to do some type of rehab, but they opt out for just the medication component. That's not going to solve the issue. It's just going to block the pain for a period of time. And as you take that medication over and over again, your tolerance to that medication also increases, which means that you're not going to be as likely to respond to the same amount. I think we're going to take a break right now, and so we can keep tackling this when we get back.
You bet. Jamie, I'm moving forward. 1-855-55 Dr. Lou, DRLOU. Give Dr. Lou a call. Get that consultation happening. And if you'd like to call in till 1 o'clock today on the Dr. Payne Show, 416-870-6400, star 640 on cell. Talk Radio, AM 640. It is 12:14. Yeah, you can call through now, 416-870-6400, star 640 on cell to talk to Dr. Lou here on the air. You have some concerns, health concerns, pain concerns. Bring him on. It'll do his best to answer you before moves the point to the clinic, which, by the way, free consultations, 1-855-55 Dr. Lou, DRLOU, and go to info@paincarecanada.com. So, talking to, or at least continue on where Jamie left off with pain management.
Yeah, for sure. So, and I was saying about how a lot of people, they're often given a pain medication and then told to go do some type of rehab. And really the medication is supposed to function in a way that you can use it so that it can mask the pain a little bit, so you can do those hard things that are required in rehab to get better. And a lot of times patients opt out to just choose the medication option because they think that that's the whole answer, or it's you can either do one or the other.
Right.
But any physical type of problem, I always say, like, it's so hard to think of a scenario where it's not needed, but a physical mechanical problem needs a physical mechanical solution. You need to be doing rehab. And when I say rehab, that's a broad class of therapies, including chiropractic, physiotherapy, massage therapy, exercise rehabilitation, different modalities, et cetera, et cetera. But you definitely have to be doing those things in order to get better. And kind of, and Jamie touched on another thing where when he goes to work, he gets re-aggravated. Another thing that should be part of treatment is identifying what the aggravating factors day to day are. Not so that you can necessarily remove them completely, but so that you can modify things the way that you're doing in order to make it so that it doesn't have that effect on you. One of the things that we do is called a job demands analysis. This is where you would go in, you would look at what a job requires in order for you to do it. For example, if you were a DJ, probably part of your job is sitting for a prolonged period of time, right? Or all
Look at
of
my
it.
belly. Part.
And now that's a very easy job to do a physical demands analysis on, but obviously other jobs can become more complicated. And then what you have to do is called a functional capacity evaluation of the individual.
Okay.
And what you're essentially looking at, you now have a list of, okay, what is required for this job? And then you check the person's capacity and you say, okay, here's what the person can actually do. And you try to look for where there's discrepancies between those two things, so that way you can make a recommendation on any type of limitation or modification. This is very, very common. We treat a lot of people that are hurt in work accidents. And one of the things that we have to do is get these people reintegrated back to work, going back to work. But when we do that in a way where we usually offer some type of restricted duty or limitation, and then gradually start reintroducing the person into their full line of work. And for whatever reason, when you go through WSIB, this is mandated that it's done this way. But a lot of people who are just getting hurt at work and then going to seek their own treatment, you can still have the clinic intervene in such a way where you say, okay, here's what I do at work. Should I be on any limitation? And that way that healthcare professional can communicate with work and just basically say, here's where we're at. Here's where this patient's at. They probably would benefit from not doing this,
So
and
accommodations need to be made.
Yeah, and accommodations need to be made between the employer and what is required of the patient's needs. And obviously, you want to work together. Everybody's got to be involved, the healthcare professional, the patient themselves, and work, so that everyone's on the same page. And in my experience, most workplaces are willing to try to accommodate so that they can keep somebody healthy.
Well, if it's a doctor like yourself, it's duty to accommodate. They have to legally accommodate.
Yeah, they have exactly. They do have to legally accommodate. So, and most people are willing to do that. It helps the person reintegrate back to work the full time. And that's where the difference is with a lot of clinics, is that, if it goes through WSIB, it's often dealt with this way. But in a scenario where you're going somewhere for treatment on your own, it's just not, they're not following the same types of guidelines, when the healthcare professional could still use that type of guideline. And again, and it doesn't just have to be work. It can also be stuff that they're doing wrong at home. So this is where the conversation between patient and doctor or patient and healthcare professional is so important, so that you can identify what are the things that are going on day to day, whether it's at work or in your other activities of daily living, that are aggravating your pain, and then get the specific recommendations to alter those things so that at the very least you can start to manage that area.
It's like a headache diary. You should keep a pain diary, right?
Absolutely. Yeah, that's a great point. That, keep a record of what's going on. When does your pain present? When is it worse? And one of the things that we do when we interact with a patient initially is we often ask about aggravating factors and relieving factors. For that very reason, we want to understand, okay, where's this being brought on, so that way we can make a change immediately.
And what minimizes it.
Yeah.
416-870-6400, star 640 on cell. Got open lines. You want to call and chat? You got an issue? Feel free. Bring it on. We'll talk to Dr. Lou here. He'll help you along with it for the next 40 minutes or so. It's the Dr. Payne Show, Talk Radio, AM 640. That is the number you call. Free consultations to get a hold of Dr. Lou. You want to chat here over the next half hour or so. 416-870-6400, star 640 on cell. Let's talk about your services a little bit, because we haven't been neglecting that lately.
Yeah. So specifically with me, what I basically spend most of my time doing, almost all of it, is a couple different things. Number one, free consultation. So what is a free consultation? Because a lot of people are confused about that. Free consultation doesn't mean you have to book in, come see me, take a day off, any of that stuff. It just simply means call 1-855-55-Dr. Lou or email at info@paincarecanada.com. Either send me an email detailing what's going on with you. I'll take a look at it, and I'll make a recommendation based on that. Or same thing, give me a phone call, hit option 2, which leaves me a message. I'll give you a call back. We have a discussion. Some people prefer to email. Some people want to have a discussion. Whichever way, doesn't matter to me. We can then have a discussion, just so I kind of understand a little bit. In the free consultation, I can't make any specific recommendations to say, hey, here's what you have to do to get better. But if it's something that, based on our conversation, I identified this is something that I can help you with, the next step is the assessment. assessment. The assessment is where you actually come in to see me. But before we get to that assessment, a lot of people call me with a lot of different issues. And if it's not an issue that I specifically deal with, then I'm just going to send it to somebody else so that there's no time wasted on anyone's part. And oftentimes from the assessment perspective, I like to take on assessments that I know I can make a difference with. It's just good business sense too on my end because I want to help people. So if I'm talking to you, I think, yeah, this is something that I can assess and probably make a good recommendation for you. Then the next step is an assessment where you book in with me. And I'm currently in the process of up until now, I was doing my assessments just out of one clinic in Etobicoke. Yep. I'm currently working on a process to set this up so that I can do it at a bunch of different clinics across, Southern Ontario to make it a little more convenient for people. And I'll keep everyone informed on that end. But so what would happen is you come in, have that assessment. What's an assessment? An assessment is I'm going to go through a thorough history. Thorough history means talking to you. I got to figure out, I got to do my detective work.
That takes a while just by itself.
A good thorough history is half an hour. I believe it was, who was the healthcare professional? It might have been Sir William Osler that once said that, listen to the patient. They're telling you the diagnosis. And that's something that's missing. A lot of people, you got to understand the full extent of everything that's going on. So thorough history related to the complaint, past medical history stuff, family history to take a consideration into genetics, et cetera, et cetera. We go through all of that. After I'm done talking, doing a history with someone, I now have an idea of, okay, what's most likely to be going on with this person? And then I do a physical exam. That physical exam is always going to include things like a posture observation and just generally observing for, any scars, lesions, anything that may point me in a certain direction. Then we're going to move on to range of motion of different joints of the body just to see the functional capacity of the person. Neurological examination, big thing that's often missed and can pick up so many things. That's where I'm going to test things like reflexes, dermatomes, which are sensation areas in the body, myotomes, which is the motor component, what makes you move. And then also what we would call some upper motor neuron testing, which is looking for anything that may be more seriously wrong in the spinal cord or into the brain. After that, you go into specific orthopedic testing and some other special testing. If I feel like you need more testing, like an x-ray, you're going to get one ordered only if I feel it's clinically indicated. And then after we've done those two processes, we come up with a plan of management. Plan of management is then, okay, here's what you have to do to get better. There's no commitment to do that with me or my health network. I'm simply going to make that recommendation. A lot of people at that point want to stay within my network, and then I will pick I'll have a discussion with them. Where are they coming from? And we'll look for that healthcare professional that's closest to them or the team that's closest to them in my health network. Another big thing that people are just calling for is second opinions. They have an MRI, they have something they've been told what's wrong, they've been given recommendations or they've been recommended for surgery or whatever, and just want my opinion on is that the best thing. Very similar to an assessment, except these people are coming in and already know their diagnosis.
Right.
They're coming in, they're saying, hey, I have a disc herniation, here's my MRI, I've been told to do, for example, decompression therapy. What do you think? And that's just a quick second opinion. That's something that, again, you don't have to follow my recommendation, but, I've encouraged my own patients to get second opinions because nobody knows it all. And so that's another service that I'm going to offer. And one other thing for people who are listening that, either help run a business or own a business or involved in the HR departments, I do a lot of speaking engagements. I get a lot of different companies that want to have me go out, speak to them, about a topic that they have a specific interest in or they want to identify with their workers. For example, if it was a roofing company, they may say, we have a lot of low back injuries. Can you educate our people on the things that they can do? This is absolutely free. Anybody listening, if you're interested to have me in a speaking engagement, give me a call, 1-855-55-Dr. Lou or info@paincarecanada.com. We'll set up a time. Obviously, I have to be available, but as long as I'm available, usually these things are about an hour to 2 hours long. I will come out to your workplace. You can put together as many people as you like, and I will talk to everybody about whatever it is you want to do, and it's absolutely free. It's not going to cost the company anything. I'm big on education. This is why I do this radio show. This is why I do the things that I do, and public outreach for me is a very, very important, and I want to educate the public.
I'm sure you've seen some crazy things. Wow, you guys need to be doing this.
I see a lot of crazy things, within the clinics, within the workplaces. There's a lot of cases out there that are horribly mismanaged for sure. And, one of the big things, corporate wellness is starting to grow very, very much. And a lot of it is tailored around get this person in to lead this class or get these new chairs and da-da-da. It's all baloney in my opinion. Education is the key. Most people, the research is consistent showing that if you can educate people on their issues or the things to do right or wrong, that's what's going to have the biggest impact. So, you can give someone the most expensive chair, but if they don't take a break from sitting, it doesn't matter how good the chair is. And they have to understand
Smart.
that. Yeah.
We'll take a short break again. 1-855-55 Dr. Lou is the number for that free consultation. Get on it and to speak to us here up till 1 o'clock this afternoon. You know that number, 416-870-6400, star 640 on the cell. Dr. Payne Show right here, Talk Radio, AM 640. 1232, got some open lines. I'd love to hear from you. 416-870-6400, star 640 on your cell.
John, one of the other things that I think is very important to address here, a lot of times people that are calling me or contacting me are not contacting me necessarily for themselves, but someone that they care for, whether it's their child or their parent, or whatever, and they just they understand that person's at their wit's end and they want a little more information. And I think that's great. And I encourage people, if you know somebody, obviously speak to them, I think is important, and let them know, hey, I think we should contact this person. I can do it on your behalf. And give me a call. Talk to me about the scenario, and let's see the recommendations. But, a call to action to those of you who have people you care for that, there's a lot of times that our loved ones don't care as much as you may care, and so you want to take that initiative, and I think that's important. That's another good reason to give me a call. And I know a lot of times people, for whatever reason, think they have to wait till Saturday at noon to give me a call. Again, you can call me at any point, leave me that message with your contact number, and I'm going to get back to you.
Again, 1-855-55 Dr. Lou, DRLOU is that number for the consultation. info@paincarecanada.com. We kind of joked about it at the start of the show, but it's been a bad couple of weeks. May's been pretty crappy already, but people do get down. There is that seasonal disorder and the vitamin D thing and the sunshine. Sure. What do you think about all that?
Yeah, well, there is good research to support that seasonal affect disorder that, as the temperature changes. And, it is a little more related to the fall months, also because the days get shorter from going from longer to shorter. And, there is a link to the vitamin D component. Vitamin D is very, very important. See, they call it a vitamin, but when they've actually looked at it, it actually functions almost more like a hormone in the body than it does a vitamin, which is very important because hormones are essential to our endocrine system and our body function. And vitamin D, our best source of vitamin D, is the sun. And, it's interesting. I don't believe that there's any links per se in the medical literature that will support what I'm about to say. But when you consider it, it does kind of make sense. When you look at neurodegenerative diseases, say something like a multiple sclerosis, they have found that the incidence of it is most common in climates like ours in Canada. And there's no research to indicate why that exactly is. But, I do think that the role of vitamin D in health is very, very important. And that limited exposure of vitamin D that we get during those months, again, does affect us psychologically and can for sure affect us from a physical perspective. And it's just interesting that the incidence of those neurodegenerative things do seem to have a higher incidence in climates like ours in Canada. And I wonder how much of it is related to the lack of sun exposure, specifically the vitamin D.
Psychological, for sure. That's probably why there's 300,000 pubs in the UK.
Yeah, for sure.
You know what I mean? Every time you turn around, there's a pub on the corner.
Yeah, for sure.
How about arthritis? I've seen a lot of this lately as well. A lot of swollen joints. It's a weird thing treating that, no?
Yeah, it's difficult. Again, arthritis. Okay, anytime someone presents with a swollen joint, you, again, have to figure out, you can't assume it's just arthritis. It also depends on what joint is it. And so, arthritis is a very broad term, and I like to separate it in two classes of arthritides. You have what's called the osteoarthritis, which is probably the more common one that people have heard of. That's the wear and tear, right? That's the stuff that we all really get some of it at some point in our lives. And we're told about arthritis in a lot of different parts of our bodies as the source of our pain. For example, we get tons of callers here that say, I was told I have degenerative disc disease in my low back, and that's why I have back pain. in the spine, it's very hard to say that the arthritis is for sure the cause of the pain. When you start looking at areas like the knee or the hip, if there's significant arthritis, there is a higher correlation to suggest that that's the cause of the pain. But then another component of arthritis that you have to consider is the autoimmune stuff. So something like a rheumatoid arthritis or a psoriatic arthritis or an ankylosing spondylitis. These are things where the body sometimes, for whatever reason, has an autoimmune attack on itself. What that essentially means is the immune system of that person's body starts to attack itself. And this is, there's a lot of different autoimmune disorders, but a class of arthritides are just related to autoimmune, like rheumatoid arthritis. This is when your body starts to attack the joint itself, and it creates the same wear and tear, except it's created from an internal factor. It's not created from a mechanical factor. So, if you were a runner and an avid runner and, we saw arthritis in your knee, it makes sense why your knee has broken down. But sometimes you can have someone that's very young and you look at their joint and it's severely degenerated, and it can be related to an autoimmune component. Now, there's other signs and symptoms that often go along with autoimmune issues. But it's, when you look at a swollen joint, you can't just stop and say for sure, yep, that's osteoarthritis. That's just normal wear and tear. No. You got to investigate. It could be autoimmune. And if it's autoimmune, you got to stop that autoimmune attack on the body itself because the long-term consequences to that area of the body can be significant, and you want to minimize that. And a lot of people have autoimmune disorders going on. And, with autoimmune disorders, the best kind of guess that we have at why things happen from an autoimmune or a lot of things, there's something in health called the two-hit hypothesis, which essentially says, because we've all heard of, is it nature versus nurture? Is it genetics or is it environment? Which one is the more important thing? The two-hit hypothesis basically says that it's both. You have to have some type of genetic predisposition and then something in the environment that triggers that genetic to come to fruition. Yeah. And that, again, is just a hypothesis. It's not law. It's very hard to prove these things. But I think it makes good sense. And, a lot of times when I've met people with autoimmune disorders, they come to, experience them after a period of stress or something happens, which to me suggests that two-hit hypothesis, although we can't say it's absolutely a law, probably does play a big role in health, that having a genetic predisposition that's kept at bay, but then triggered by some type of an environmental factor, right? And so a lot of this stuff exists where you have to look at genetic predispositions and tie them into the environment that they're in. And they do this stuff with some people. Say, for example, like breast cancer. If someone's diagnosed with breast cancer, they'll then suggest that their kids, if they have daughters, get checked for, BRCA1 and BRCA2, which is a genetic component to breast cancer, for that very reason. That way they understand, okay, if there is a genetic predisposition, what are some environmental things you can do to diminish the likelihood that genetic component gets activated. So it is important, and they do have certain things that they will do this for.
We'll take a quick one, 416-870-6400, star 640 on cell. You can give us a call. We'd love to hear from you up until 1 o'clock today. It's quiet. We got open lines. And for that free consultation, 1-855-55-DR-LOU, DRLOU, or info@paincarecanada.com. Drop Lou an email and take it from there. The Dr. Payne Show, Talk Radio, AM 640. It is 12:44 on Saturday afternoon. We'll get right to you. Caroline, good afternoon. How are you?
Oh, hi. I love you, by the way. I love the show. I hope you're always on the air.
Thank you.
I remember you, Dawn. You used to be on Q1 Saturday.
Still am.
Voice.
Mm-hmm.
Great.
Still am.
Great.
Only been 18 years.
I thought she was complimenting you, but she likes you, John.
Yeah.
I love the other guy. He's got a great voice, too. But above all, the reason why I'm calling my poor mom, she's in her 70s, and she tried to call in, but she couldn't get through. But I really worry about her because she's got a lot of arthritic pain, and it's to the point where she could hardly walk.
Okay.
But she doesn't want to take all the, the painkillers that are really, addictive. So I just wanted to know what you can suggest to help my mom.
Sure.
If she doesn't have any pain.
So where is the pain exactly?
Well, it's in her leg. My mom said she's got a lot of, both me and my mom have scoliosis.
Yeah.
That's one thing. But the pain mostly is in my mom's left leg, and it's around her knee. But she's got this thing called, I can't think of the name right now.
Okay.
I can't, sciatica.
Okay, yeah.
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 So what can she do to help that?
Yeah, so again, sciatica is a general term that basically tells us that a patient has leg pain often related to the sciatic nerve. What you then have to do is try to figure out what's irritating the sciatic nerve. Could be something like a tight muscle higher up around the glute area. Could be something in the back like a disc herniation or stenosis. And so that's the harder thing, right? This is where I was kind of talking about, this is kind of the example of a consultation. So you're talking to me, we're going down this line. And now my next thing that I would probably say is that's where an assessment's needed, because I would have to look at your mom and try to figure out exactly what that irritation is being caused from. Because it may not necessarily be arthritic. If it's stenosis related, stenosis can often be an arthritic process. But let's assume it's something else, like a tight muscle. Well, then it's not an arthritic process. And so, these, and this is kind of the issue with pain, and not your fault, but just in general, the way we've come to accept it, is that not all pain is the same. And so we have to figure out what I always say is the pain generating source. What's creating the pain for the person? In the example of the knee, if let's say it is arthritis, that the joint is really worn down. Well, this is an example where knee replacements are where, I always think surgery should be a last option, obviously.
I agree.
But sometimes it's the best option. And so for something like a very severely arthritic, degenerated knee, oftentimes a knee replacement is one of the best things that you can do. And I work closely with a couple of surgeons who just dedicate their time to knee surgery. And the outcomes are very, very good. Now, that's assuming that it's that severe. I'm just talking or thinking out loud based on your mom's scenario. But what we would really have to do is try to figure out exactly where her pain is coming from. And then once we understand where her pain is coming from, then we can make the recommendations on, okay, here's exactly what you can do to get that better. So that's kind of the step. Does that make sense?
Oh, yeah.
Yeah.
Can I just say one thing? My mom mentioned, I was sorry, I was in the bathroom. I didn't quite hear what you were talking about, something about autoimmune something.
Yep.
But I think my mom's got that because my mom's she doesn't have a thyroid. She's on thyroxine.
Yep.
Maybe that's got everything to do with her pain, maybe.
How old's your mom?
She doesn't want me to tell her real age, but she's 75.
Okay. Yeah. Autoimmune stuff is not, it depends on which ones, but, not as likely to rear its head that late in life. A thyroid issue is not necessarily an autoimmune issue. But again, this is part of the conversation of trying to figure where I do my detective work, where I go through everything to try to figure out exactly what's going on. And I don't make any, preconceived determinations. I try to look at every patient and start from scratch and say, okay, what are all the possibilities here?
Oh, well, I think you're really great, and you've helped me a lot. So what can I do to get my mom to come and see you?
Yeah, if you've left your number with the call screener, I'll get in touch with you. I try to call back everybody that calls into the show just to follow up with them. So I'll do that, in a few days, and then we can have that conversation.
Okay, thanks for helping me and my mom, and you're great, and I love you guys.
Thanks, Caroline. You're a doll. We'll get to Ian quickly here before we break. Sure, got a minute. Ian, how are you, pal?
Good, thank you.
Good. What's going on with you?
Yeah, I just was curious because I know some ladies that love playing sport, and we all like to see the ladies enjoy themselves. But the issue I have, and I'm wondering if it's preventable, is the amount of cruciate ligament damage in sports for female, in sports such as softball and soccer.
So you're talking about specifically in the knee? Yeah.
Cruciate ligament.
Well, there's a couple of them, whether it's the anterior or the posterior. Right. You are right. It could be more common in females. There is a little bit more laxity there. The biggest thing from an injury prevention standpoint. So, when I was growing up, I remember in gym class, the teacher would get you in a circle and make you stretch. And there's a conversation on what's more important, stretching or warming up, which let's touch on that when we come back. But that'll answer the question.
Yeah, we'll talk about that. 416-870-6400, star 640 on cell. This number you want to call through. And for that free consultation, 1-855-55 Lou or info@paincarecanada.com. Dr. Pain Show, Talk Radio, AM 640. And Ian, thanks for hanging in, fellow. Where were you? Pick it up, Dr. Lou.
Yeah, so we were talking about, it's a hard question to answer on exactly what you can do, but one of the things that we find prevents injuries is warming up. So within muscles, you have enzymes, and these enzymes tend to work better at a certain temperature. And when enzymes are working, they just make the body work well. That's their job, is they essentially help the process of the body. And so what they've basically found with a lot of research when they looked at what's better for injury prevention, stretching, because that's what we all used to do, or warming up. Warming up is definitely the better option. So my recommendation to anyone who wants to try to prevent injury, a musculoskeletal injury, is go through some type of a warm-up phase. It can be stretching, but it has to be dynamic, where you actually get your heart rate up, you get your body warmed up. And this is one of the things I was talking about, speaking engagements at workplaces that I do. One of the biggest things that I recommend, especially to people who are on construction sites during the winter months, is don't just get to work, get out of your truck, and start lifting heavy things. Walk around a little bit, get your body warmed up, especially if the temperature is cold, right? You have to work a little bit harder to get your body warm. And so warming up is probably the thing that I could say is the best recommendation to, at the very least, try to prevent injury. The other thing is understanding your body. Some people may already have a lot of laxity on one knee. Well, maybe wearing a brace then, or if you've had a previous ACL injury, again, wearing a brace may help to prevent another one. So understanding the previous history of the individual is important to understanding what they're more likely to sustain going forward.
Yeah, I understand. Like, I've taken the National Strength and Conditioning course, and they talk about it in terms of percentages. And apparently, women that have hit puberty, after puberty, it's like they're 5 to 6 times more likely to tear a cruciate ligament than a man is. Mm-hmm. So I was just, if that's in fact true, is there some way of either training them, or can they wear, like you say, wear a brace? Or I understand the warm-up thing. A friend of mine plays on a softball team, and she said, on our team we have 23 cruciate ligament tears. Mm-hmm. And I'm going, something's got to be done. So I was just wondering what you had in mind, and I appreciate that.
One of the other things that happens at puberty is once a female hits puberty, their pelvis widens. Mm-hmm. Men have, when you look at the angle of the knee from the femur, there's something called the Q angle, which is the measurement of how straight is that. Obviously, on a female with a wider pelvis, that angle, there's a bigger angle, which means there's more pressure put on the knee. That's why women tend to sustain knee injuries like this. So again, also that goes back to understanding the female. Not every female has a very, very wide pelvis, but some do. And if you do, then the likelihood of a knee injury may be increased. And this is where speaking with someone looking at the functional the way the body works specifically to an individual, its function, is important to looking at or understanding problems that may rear their head in the future.
Hey, Walter, welcome to the show. Good afternoon.
Hi, how are you?
Good, pal. What's going on?
I was diagnosed with bursitis just over a couple of years ago,
mm-hmm.
and the doctor said it would probably go away in about 3 months or so. Well, it never went away. It got worse, and now I've got arthritis in it.
Okay, where is the bursitis? Let's start with that.
It started in my right hip.
Okay.
And now it's in both of them.
Okay, so a bursa is just a fluid-filled sac that essentially, it works kind of like a padding between a muscle and a bone. That way, the bone is not contacting the muscle during movement, or else it would pop. So a bursitis is when that sac gets inflamed. It would not necessarily lead to arthritis. And so a bursitis is an inflammation process, so it needs to be treated from an anti-inflammatory perspective with things like, ice, stretching, pain medications, releasing whatever pressure is causing that bursa to be inflamed. The chances are that if you had arthritis, or you have arthritis in that hip, that arthritis has been developing much longer than just over the last 2 years of the bursitis.
Right, I agree with that.
Yeah, for sure. So what?
But I've had, I forget what you call it, PBR, like a stem cell where they take your blood.
Yep.
And that was really expensive. I couldn't keep doing it. It didn't work.
Mm-hmm.
And I've had cortisone shots.
Okay.
That didn't work. And also they gave me some sort of sugar shot.
Okay. And this is in your hip?
In my hip.
Which hip?
Right.
And where is the pain? In the front or the back?
In the back side.
In the back side, yeah. So that's another thing to consider. Again, a lot of times there's pain in that general area of the body. Mm-hmm. People often say, oh, that's the hip joint. Well, it could also be the SI joint, which is a little bit higher. It could be the muscles in that area. It may not necessarily be the hip joint, which is the articulation of the femur and the acetabulum, just because that pain usually tends to be more in the front, and not necessarily always, but Walter, this is a good example where obviously me assessing your issue, I could take a look at it and then give you that second opinion where I could say, okay, here's what I think's going on. In all likelihood, if those things have not worked, well, maybe the diagnosis is wrong or the options you've been given are wrong. So, if you're interested, give us a call. We'll take a look at it.
Good way to wrap it for today, Walter, and everybody else. It's 1-855-55-Dr. Lou, DRLOU, 1-855-55-Dr. Lou, or info@paincarecanada.com through email. Get that consultation happening, get the assessment, and move forward from there. Till next weekend, right here on Talk Radio AM 640, this has been the Dr. Pain Show.